Is working in the fetal alcohol spectrum disorders clinic. I work in the adult side of the clinic, so we have adults that we see with this disorder. So today I'm going to be talking to you about what is FASD, how do we diagnose it, what does it look like, and what are some of the challenges that you might see in working with these individuals. I was really pleased with the last presentation. Catherine did a great job of talking in general about some of the issues that we also see in FASD, so you'll hear it reiterated again in my presentation. So what is FASD? Well, it's damage caused by alcohol, exposure to alcohol in utero. So that is damage caused by a mother drinking alcohol during pregnancy. We call it prenatal alcohol exposure. So there's two things that people frequently ask when we talk about prenatal alcohol exposure. The first is, how much? What's the amount? And the second question is, what about dads? We talk a lot about women, so what about the men? So the first question has two answers. And the first answer is the answer that you're going to give if you're ever talking to a woman who is pregnant or is contemplating pregnancy, or couples who are contemplating pregnancy, and that is that there is no safe amount of alcohol, period. You should not drink alcohol during the pregnancy. There are lots of slippery slopes that can be gone down about small amounts, but the truth is we don't know of any safe amount. So you always must tell people that there is no safe amount of alcohol in pregnancy. The second question might be, for someone like me who works in a diagnostic clinic, is once you have an individual who's been exposed to alcohol, how much does it take for us to be quite certain that the damage you're looking at was actually caused by the alcohol? And that is laid out in our diagnostic guidelines. We look at the amount of alcohol that people have consumed and the effects. And we know that 7 to 10 drinks in a week or 2 episodes of binge drinking are quite certain, are certain enough to be the cause of damage in pregnancy. So if you think about that, that means 1 drink of alcohol, 1 glass of wine with dinner every night, or 2 binge episodes, that's 4 drinks on an occasion. So if a woman gets pregnant in November and goes out for New Year's and has 4 glasses of champagne, and then decides she's going to go out for her birthday to celebrate, has 4 more glasses of champagne, that is enough for us to be fairly certain that there can be damage. So it's really important, I'm making this point very strongly, it's very important for you to understand that for the vast majority of people, drinking alcohol is a fun activity you can engage in with very little negative outcome. But if you're pregnant, for women who are pregnant, alcohol is very dangerous, and it's very important to understand that. And the men, right, the men. So right now, male contribution to drinking does not factor into a diagnosis of FASD. Okay, wait, wait, there's more. Can you hear me okay? This feels like it's not, well there, that's better. So, right now, it does not factor in. I love this guy. However, in animal studies, we've been able to show already that excessive drinking by males damages the sperm. So that is in animal studies. It's not been shown in humans, but think about it, right? It's quite likely. And the sperm, of course, is transmitted to the baby, and that could very well result in damage. I suspect that if we talk about this in 10 years or 20 years, that we may be talking about the male contribution. There's a lot of work being done now in this area. And of course, there's also the other side that we know, everyone knows. I don't have to tell you the studies on this, but you know it. If the male partner stops drinking during the pregnancy, the woman is much more likely to quit drinking too. If the male continues to drink, she's more likely to continue to drink. So men, you do have a responsibility here. Partners of all kinds have a responsibility to help their partner have a safe pregnancy. So I'm a psychologist, so I'm going to talk a lot about FASD as a brain disorder. But it's important to know also that it is a full body disorder. There's lots of research that's been done around this more recently to show that there are physical, medical, and cognitive and behavioral outcomes of alcohol and use in pregnancy. going to show you this chart. It's pretty busy. I don't have a pointer. It's pretty busy, but there's only two things I really want you to kind of take from it. It's from a textbook on development by Patricia Mills. If you look along the top of the picture, you'll see the numbers 1 to 38. Those are the weeks of pregnancy. Underneath that, you see pictures of babies developing from a zygote to an embryo to a fetus. And in each of those kind of areas, you see little landmarks for different pieces that are developing during that point. If you go underneath the pictures of the babies, you see lines, and the lines are blue and green. Blue represents the sensitive period for development for a particular part of the body. And green represents the critical period. So anything that's blue and green means that during that period, a teratogen, such as alcohol, it's a damaging substance, can have an effect on that particular part of the baby's development. So I don't know how well you can see it, but the first line is the central nervous system. It's not that easy to see. Central nervous system is the brain. So the critical period from the brain goes from the 3rd week all the way to the 38th week. So if you drink alcohol during any of those periods, you will very likely result in damage to some of the central nervous system. The heart is the second line underneath that. And if you look at that, the blue line extends from the 3rd week to 8th week. So again, drinking during that period is likely to cause damage to the heart. And so on and so on. You've got upper and lower limbs, you've got external genitalia, ears, eyes, teeth, etc. And this is only some of the things that are developing. So the reason I'm showing you this picture is two things. First, notice that damage to the central nervous system occurs at almost every point in pregnancy. So drinking in pregnancy is most likely to harm the brain. The second thing is that drinking at different points in the pregnancy is going to have different effects. So you're going to get different outcomes for individuals depending on the type of drinking. So if you drank at the 8th week, it would be perhaps different than if you drank at the 3rd week in terms of outcomes. So that's why people with FASD are like snowflakes. It's kind of an obvious thing to say that there will be different outcomes. There are some similarities, but the outcome is going to be influenced. The symptoms and the presentation are going to be influenced by the amount of alcohol consumed, when and how it was consumed, and pre-existing genetic disorders and genetic factors. The other question that people ask a lot around FASD is how many, how much, what are the numbers? And we are very fortunate to have a recent prevalence study that was done by Dr. Lena Popova at CanAge. It's an excellent study. We used to say we thought that the prevalence of FASD was about 1% in the population. But that was based on clinic studies, people coming to clinic presenting with the challenges. And as you may guess, FASD has somewhat of a stigma attached to it. So you don't always get people coming to clinic looking for help. What Dr. Popova did was go out into schools and test as many children as she could. I think it was grade 4 and 5. And she looked at all the children and assessed them for FASD. And what she found was a rate of 2 to 3%, which is quite a number of people. It's quite a large number. Lots of people were quite surprised by this. So how do we diagnose FASD? Well, it's usually done by a team, a medical professional, and then allied health professionals like psychologists, speech paths, OTs, and the like. What we do is we look for evidence of prenatal alcohol exposure, and then we do assessment of a variety of different abilities. These are the 10 abilities that we typically will look at. We look at IQ or cognition, motor skills, language, academics, memory, attention, executive functioning, which I'll talk more about later, affect regulation, which I will also talk more about later, adaptive behavior, which is daily living skills, and neuroanatomy. So I don't talk a lot about it, but usually prenatal alcohol exposure is confirmed through talking to the mother or the father or someone who knew the mother while she was pregnant. But there are some very rare cases where you can establish prenatal alcohol exposure without the confirmation of a family member or someone who observed the drinking. And that's when you have the full facial features. There are 3 facial features that come with FASD. And if an individual has all three in the severe kind of range, then we can infer that the mother drank alcohol during the pregnancy, even without being able to talk to her. It's very rare. It happens sometimes in about up to 10% of cases. And it requires a very large amount of drinking through the pregnancy. So what are the challenges most often seen in FASD? Well, there's three. Having said that people with FASD are like snowflakes, I'm going to kind of backtrack a bit now, and I'm going to say there are three things that I want you to know about, three important aspects of this group. First is the uneven or scattered profile. Second is affect dysregulation problems. And third is executive functioning, which Catherine talked about a little bit too. So bear with me. I'm going to spend a little bit of time on this slide and talk to you a little bit about what it means to test somebody's abilities. So the first kind of aspect of FASD that I want to talk about is called the scattered profile. And that means that people with FASD have big ups and downs in their ability. So when I do testing as a psychologist, what I want to know is I want to know what's your general problem-solving ability. That's your IQ. Right? I want to know about your IQ. I want to know about your abilities across a variety of different areas. So IQ, for anyone who is not familiar with the idea, IQ is your general problem-solving ability. So if I want to find out your IQ, I could follow you around all day and see how well you solve problems. But that's a little bit impractical. So what we do instead is we invite you to our office and we sit you down and we give you a variety of different tests of ability. So we'll test your language skills, your visual spatial skills, your memory, your executive functioning skills, and a variety of other ones. We'll give you a small task to do. We'll give you a score for that task, and we'll compare your score to other people of the same age. Then we'll take all those scores, we'll add them all up and average them out, and that is your IQ. It is literally the average of your overall problem-solving ability. It's a system that's worked really great for over 100 years for absolutely most people. However, we have a bit of a problem with it when it comes to FASD. So I'm going to show you a couple of IQ profiles just to give you some ideas of what I'm talking about. If you look at this graph, along the bottom, you've got the different areas of skills. So language, attention, memory, visual spatial skills, and executive functioning. That's just a few. We do more. Up the side, we have IQ scores. So at the bottom is an IQ of 40, which would be in the range of intellectual disability. At the top is 120, which would be in the gifted range. And 100 is dead average. So if you have an IQ of 100, you are average. So the first kind of profile I've highlighted is of an average person. Let's say it's my IQ scores. My language skills are a little bit above average, which is 100. My attention is not as good, it's a little bit below. My memory is pretty good. My visual spatial skills are not very good. They're a little lower. I'm not very good at making IKEA furniture, which is the ultimate test of visual spatial skills, by the way. Executive functioning is pretty good. It's appropriate for my age. So if I add all those up and average them out, you get my IQ, and it's a pretty good estimate of my overall abilities. They all fall within a range, and that is the average range. The one across the bottom, this is the IQ profile of a person with an intellectual disability. Again, ups and downs, a little better memory, a little bit less language, but overall within a range. So knowing one ability will give you a pretty good idea about the other abilities the person has. Through the middle is the profile of a person with FASD. It's all over the map. You have good visual spatial skills, just like mine. Really poor attention skills, like a person with an intellectual disability. Executive functioning, also very low. So it's all over. So why am I telling you this? Why am I spending so much time on this? I'm telling you because if you're working with an individual with FASD, you will be fooled. You will be fooled by their abilities because they'll be good at something. They'll be good at some things. And you'll look at those things that they're good at and say, if he can do that computer program, if he can play that, or he can put that object together so well, he can put together that IKEA furniture, why can't he do X, whatever X is, that other thing? Why can't he do well in school? Why can't he follow instructions? Why can't he do this or that? And you're going to think that the person's being difficult or obstinate or not trying hard enough. But what I want you to consider is also the possibility that you're looking at a scattered profile. You're looking at someone who is really good at one or two things and has some real problems with others. So think about that when you've got someone who's able to do one thing. We do this all the time too. I guess I want to point that out too, is that we all make assumptions about other people based on one or two abilities. You'll listen to me today talk and you'll say, she sounds like she's probably at least average intelligence. She can probably drive a car, probably get a job, you know, look after the house, make it to appointments, more or less right. But that's violated, those assumptions are violated for people with FASD. Just because they can do one thing doesn't mean they can do the other. So that's a scattered profile. Next thing I want to talk about is affect regulation. Should have been called affect dysregulation. Affect is emotion, regulation is control. Put them together, you've got affect regulation. So the ability to control emotions and regulate them. People with FASD have problems with affect regulation. They have a difficulty with controlling their emotions. They often have excessive emotions to environmental kind of aspects of stress in life. So why do I think that just because a person with FASD has some emotionality, why do I think that that might be related to the alcohol, the prenatal alcohol exposure? Well, I think that because there's some excellent research done in Canada, by the way, at UBC, by researchers who have done work with mice, animals of various kinds. And they've been able to show that if an animal is exposed to alcohol prenatally, a part of the brain called the HPA axis, hypothalamic pituitary adrenal axis, is damaged by the prenatal alcohol exposure. You don't need to know what an HPA axis is, it's really long, complicated. But you may recognize the word adrenaline, right? Adrenal, adrenaline, they're related. That is the central stress response system of your body, the fight or flight. So, if you're talking about the ability to be physiologically aroused in order to react appropriately to a stressor in the environment, that's what you're talking about, the HPA axis. So, in FASD, prenatal alcohol damages this system and leaves it predisposed to be hypersensitive or hyperreactive. So people with FASD are more likely to be hyperreactive to stressors in the environment, to overreact. And this leads them to vulnerability with mental health problems, anger problems, and a variety of different impulsivity. Last thing I want to talk about, so that's it. Scattered profile, affect dysregulation. Last thing is executive functioning. Executive functioning is a big concept. It's about working memory, impulse control, planning and problem solving, and a variety of other different pieces. If you imagine the part of your brain, if you imagine your brain like a company, like a corporation, your executive functioning is the corner office, it's the CEO. It's the part of your brain that's in charge of making decisions, planning ahead, being flexible, changing, and being able to adapt to the situation. And people with FASD have problems with executive functioning. As Catherine said, for other sorts of brain damage as well. The part of executive functioning I want to talk about really quickly is working memory. So working memory is a piece of the executive functioning system. And I like to, the best description I saw of it is a mental sticky note. So it is the ability for you to hold a small amount of information in your immediate memory and work with it, right? So it might be to work with it to follow instructions, hold information and follow the instructions. It might be to hold information and make a decision based on it. So imagine that I'm sitting at home last night and it's 8 o'clock at night and my friend calls me and says, hey, do you want to go to the movies? And it's a 9 o'clock show, we're going to go see A Star is Born. And I'm like, hey, I'd like to see that movie. But let's see now. My first reaction is, yes, I want to go. But then my working memory kicks in and I say, So if I go out at 9, I'm not home till 11, and then I'm not asleep till 11:30 or 12. I got to do a presentation tomorrow. I have a few things to do in the morning. I'm going to be pretty tired, so probably that's not a good decision. And I'm able to pull from my schedule and the things around to make that good decision. People with FASD are going to say, yeah, I'm going to that movie. And they're not able to pull pieces together to make a good decision. So what happens when you have executive functioning problems and affect regulation problems? Well, all sorts of different stuff happen. Impulsivity, overspending, alcohol and drug problems, difficulty with appointments. I want to point out too about the appointment issue is if you're providing service to people with FASD, just because they don't show up for appointments doesn't mean they're not interested. Frequently it's to do with organizational problems, and please try to be patient and work with them because that's a very common problem. And of course anxiety, depression, loss of temper, and a variety of different things go with it. So here's the stats from our clinic. That's Surrey Place, by the way. That's the place I work. It's a lovely old building. This is the stats for our clinic. There are about 100 people, 100 adults been through who have been referred for FASD assessment. And this is the rates of different problems that we see. 85% have had trouble with the law. That's a big number. 46% attempted suicide. Clearly they didn't succeed or they wouldn't have shown up at my clinic. But the attempts, that's a serious issue. Mental health problems, addiction problems, 77%. That's a big issue too. And parented a child, 46% have parented a child, very often at a young age, before 18 years of age. So what I want you to see in this table is put together the two last lines. You've got a group of people who have a high level of addiction problems and are having children at a young age. And you can see how FASD can become an intergenerational problem. And that's why I'm very strong proponent, shall we say, of promoting no drinking during pregnancy. It's very important. These are the mental health diagnoses that we see in our clinic. I'm not going to spend too much time about it. But as you would expect, mood disorder, ADHD, conduct disorders, those kind of things are very common. I'm going to talk to you a little bit about resources now. FASD 1 is an excellent place to go looking for information. It's FASD Ontario Network of Expertise. They have a great website, lots of information about justice, education, diagnostic clinics, etc. POP FASD is the provincial outreach program. I think it's BC, but it might be Alberta. They have great videos for education, lots of good information. And we have now in Ontario a position called FASD worker. They are individuals embedded in different agencies who are committed, their job is to help individuals with FASD navigate the system, get services, educate. So I encourage you to use them. We have one at Surrey Place, you can call us, but other agencies also have them across the province. We have a diagnostic clinic at Surrey Place. I invite you to call us if you have individuals that you suspect have prenatal alcohol exposure and would benefit from a diagnosis. And final thoughts. I want you to remember the scattered profile and how it can make it really hard to predict and understand what people with FASD can do. And often disability is mistaken for bad behavior, so try not to make that mistake. Executive functioning and impulsivity can make service provision challenging, so if you're a service provider, think about ways that you can help with the planning, the organization, and counteracting the impulsivity. And support, supervision, and interdependence. Interdependence is my new favorite word. It refers to the idea that you can't just support an individual, give them education, and let them go. You have to understand that this is a lifelong disability, as are most neurodevelopmental disorders, and you need to keep going with the support. You can't educate and let people go. You can't expect them to succeed. They need ongoing support and help to succeed in their lives. And that's all I got.